Okay, this is the practical demonstration for MSK 1. We are looking into a few images and slide. First image is on myasthenia gravis. So this is the eye sign of myasthenia gravis. So basically, the drooping of eyelid you can see here is actually seen in all the patients that come with myasthenia gravis, and upon treatment with uh, hydrophonium, basically it actually causes the symptom to be elevated. So this is actually pre hydrophonium, and this is post hydrophonium. The next image is on Duchenne muscular dystrophy. So basically you can actually see both of the calf here has enlargement. So this is almost like a hypertrophy, but it is not hypertrophy because it is filled by fat. So this is called calf pseudohypertrophy. The next one is on malunion of the bone. So this is actually a bone of a patient who had a fracture, but the thing is that because of it is not aligned, okay, it is not aligned, healing occurs, but it is actually abnormal because of the misalignment. So this is what we call as malunion. Okay, area of malunion. Next is non-union. So basically you can actually see from this x-ray there's actually a fracture there, right? Okay, and when they did the CT scan, that the fracture did not completely fuse after treatment, and you can actually see that there's actually some healing occurring there and there, but it is not completely fused. So this is what we call as non-union. The next one is image of osteoporosis. So basically this is actually a vertebra. A normal vertebra usually have a very thick trabeculae, but you can actually see here that this area become porous, and you can actually see that there is actually a reduction of the bony trabecula. Next one is rickets. This is a clinical signs of rickets because of lack of vitamin D. There's actually weakening of the bone, causing the bone to become bowing. Okay, almost like a bow of an arrow. Okay. Next is Paget's disease of the bone. So basically, this is actually a cross sectional of a skull. Alright, so basically this is actually a cross section of a skull bone, and you can actually see there's actually areas of this cortical bone thickening. Okay, all right. The trabecular, even though it's minimal, is also thickened in this area as well. Next is lipoma. So this is actually a benign tumor, as you have learned in your general pathology. So it is actually well circumscribed. Okay, sometimes you can actually see the capsules there. All right, well capsulated, and the cut surface is actually homogeneous. It's yellowish, right? There's no area of hemorrhage or necrosis seen here. Compared to the malignant counterpart, this is liposarcoma. So even though you can actually see a capsule here, but this area there's no capsule. So it is actually poorly demarcated, okay, does not have proper demarcation, and it is actually poorly capsulated, especially in this area. And the cut surface is heterogeneous. You can actually see areas of hemorrhage there, and you can also see areas of necrosis there and there. Okay, right. Next is the virtual microscopy. So when you click the link, the microscope link, you can actually, you will you will open this page. So basically you can actually see from low power itself, this is actually a bone. So this is actually the cortex, and this is actually the trabeculae. And you can actually see that this trabeculae over here is almost normal, but here this trabeculae is not connected. So this is actually what we call as loss of trabeculae. And if you look into this trabeculae, all right, majority of it are actually thinner than the usual. Usually it should be thick as this, but it is actually thin. All right, so this is actually thinning of bony trabeculae as well as loss of bony trabeculae there. Next is Paget disease of the bone. So when you click the link, this is the image that you will look into. zoom in into this area, so you can actually see the bony trabeculae. Compared to osteoporosis just now, the trabeculae is very thick, but most importantly, very thick, and you can actually see the cement line. Okay, the cement line is actually quite thick. Okay, the cement line where they overlay the osteoid. Okay, and most importantly, you can actually see, because of this thick line, it almost forming like a mosaic pattern. Okay, so this is what we call as mosaic pattern. The whole thing is actually mosaic pattern. Next one is lipoma. So when you click the image, click the link, you will be given this image, but just focus on to the tumor. Then you can actually see it is actually composed of proliferation of adipocytes. So this is basically adipocyte, and this is mature adipocyte, because you can actually see that the nuclei sits at the periphery of the nucleus, almost like a normal normal fat cells. Okay, it's just that it is actually proliferating. So this is lipoma. Compared to the malignant one, this is actually the image when you click in the liposarcoma link. It is still fat, but the nucleus is no more small, it's large, and you can actually see some of the cells nucleus becomes big like this. So this is what we call as lipoblast, and because this is malignant cells, you can actually see the features like hyperchromatism. Okay, the size is different. You can actually say this is pleomorphic. All right, okay, and then because of size of big size, you can actually say that the cell has increased NC ratio, and this is actually the mitosis. Okay, a feature of malignancy. So this is liposarcoma. All right, thank you.